Today we are going to start our fourth and last lecture of Ocular appendages unit from the Ramaysophthalmology book. To get the maximum benefit from these videos, watch the video, read the topic from the Ramays, and then give the answers which are given at the end of these videos. So let's start our today's topic, which is the lacrimal apparatus. Lacrimal apparatus consists of different parts which we will study. Lacrimal apparatus consists of lacrimal gland which secretes the tears into the nasolacrimal duct. Look here in this diagram that this is the lacrimal gland. It secretes the tears into the this is the nasolacrimal duct. So it lacrimal apparatus also consists of lacrimal canaliculi. These are present here. These are the canaliculi and this small structure present here. This is the lacrimal sac. So these ducts carries the tears into the nasal cavity. There is also lacrimal canaliculi and the lacrimal sac I have mentioned already. Besides the main lacrimal gland, there is accessory lacrimal glands present. Accessory, which is known as accessory lacrimal gland of Ross, which is in the upper fornix. They produce basal tears. So, in the normal conditions, these are the glands which produce the tears, keep the cornea moist. Main lacrimal gland comes into action when there is psychogenic or the irritable stimulus. So, they produce the tears in case of psychogenic or the irritable stimulus. That is a very important point that in under the normal condition only the accessory lacrimal glands are functioning. Now we will study the lacrimal gland structure in detail. First of all, what type of gland is the lacrimal gland? Lacrimal gland is a serous gland. It is a serous type of gland. And other MCQ, very important. Lacrimal gland has lobulated tubuloacinar structure. Okay. Again, come to the diagram. Look here that this is the main gland. If we take, it consists of two lobes. One is the upper lobe and the second is the lower lobe. If we take only one lobe, these lobes, each lobe consists of different lobules. Like these lobules, okay? In these lobules, there are different acini present, like these. These acini secretes the tears into the tubules. Okay, so lacrimal glands have the lobules. These have the acini. These have the tubules that secretes the carries the tears from the lacrimal gland. So these are known as lobulated tubuloacinar structure. Now let's move to the next part. The lobules which I have shown to these are separated by the loose connective tissue. Loose connective tissue. Lacrimal gland has the two parts. I have shown you larger orbital part, smaller palpebral part. Okay. Again, see in the diagram. Look here that This is the larger part. This is known as the orbital part. Orbital part. Look here. Orbital part, superior part of the lacrimal gland. This smaller one here. This one. This is the palpebral part, inferior part of the lacrimal gland. Okay. This is the second part, and the upper one is the first part. These two parts are separated here. These two parts are separated from each other by tendon of LPS muscle. Okay. So this is another MCQ, and this is also an MCQ that which part is the larger part, superior part, or the orbital part is the larger part of the lacrimal gland. Now see that larger orbital part, this is an almond-shaped structure that lies in the lacrimal fossa on the anterior and the lateral part of the roof of the orbit, or we can say that lacrimal gland lies in the frontal bone, which is the major part of the roof of the orbit. Again, we have to see the diagram. Look here that this is the roof of the orbit. This hole here is the roof of the orbit, which is made by the frontal bone. Here is the lacrimal sac fossa formed by the frontal bone. The major part, the orbital part, lies in the lacrimal sac fossa in the superior part and the lateral part. Lateral part. Okay, remember this. Look here that lacrimal gland fossa formed by the one bone and the lacrimal sac fossa formed by the two bones. Larger orbital part. Now we will study the palpebral part, which is the smaller part. It lies below the levator superioris muscle and extends into the upper eyelid. I have already mentioned that the two parts of the gland are separated by the LPS tendon. So the smaller part is lying below the tendon of the LPS muscle. The next important point is surgical removal of the palpebral part destroys the drainage of the whole gland. If we see the structure of the if we see the structure of the lacrimal gland, look here that this is the larger palpebral part, and below here is the upper one is the larger orbital part. This is the orbital part, and this one is the smaller palpebral part. Tears come from the upper part to the lower part, and then these are carried by the ducts to the nasolacrimal duct. So, if we remove this gland, the smaller lower part, then the whole drainage will be gone. Okay, we cannot drain the tears from the larger orbital part as well. So, whenever we have to perform the surgery, we have to choose the orbital part. Okay, surgery, any kind of biopsy, we have to choose the larger orbital part to perform any surgery, to perform any biopsy, because if we remove the lower part and perform the surgery on the lower part, there will be no drainage. Now let's move. Lacrimal gland has 12 ducts. Again, a very important MCQ. They open into the lateral part of the superior conjunctival fornix. Lymphatic drainage of the lacrimal gland is another MCQ, is into the superficial parotid lymph nodes. Orbicularis oculi muscle helps in the lacrimal drainage. So its contraction causes the pressure on the lacrimal sac. We know that all the tears are coming to collect into the lacrimal sac. So when there is contraction of the lacrimal sac, it causes its emptying, and this contraction is done by the orbicular circular muscle. This is why this muscle is important part of the lacrimal pump. Important part of the lacrimal pump is orbicularis oculi. Facial nerve palsy leads to the paralysis of the orbicularis oculi and the sagging of the lower eyelid. Both these factors lead to epiphora, increased tear secretion, tear escape over the lower eyelid. Paralysis of the orbicularis oculi also causes the ectropion, in which condition lower eyelid moves away, swag away from the eyeball. Here you can say this is the ectropion due to the facial nerve palsy leading to paralysis of the orbicularis oculi muscle. So, orbicularis oculi muscle is attached to lateral raphe. Tear film is drained in the superior and the inferior puncta. We have already studied this structure puncta. Tear drain through the lacrimal puncta and the canaliculi. There are upper and the lower canaliculi. Injury to the upper eyelid. Cause of bleeding is from the marginal arcade. This is a very frequently asked MCQ. Please remember this. So, if there is bleeding in the anterior chamber, that is from the circular iridis major structure. Please remember this as well. Our next topic is nerve supply of the lacrimal gland. Nerve supply of the lacrimal gland is very important. I will try to make it easy with the help of diagrams. First of all, we will see what is the basic structure of the nerve supply. There are two kinds of supplies. One is the autonomic and the second one is the sensory. Autonomic is sympathetic and parasympathetic. Okay, and parasympathetic, and second one is the sensory. First we will see the sensory supply because it is short and easy to remember. Sensory supply of the lacrimal gland is from the trigeminal nerve. From the trigeminal nerve. Which branch? From the lacrimal nerve branch of the ophthalmic division of the trigeminal nerve. Okay. Here is you can see that here is the lacrimal gland present. We have seen that the sensory supply is derived from the ophthalmic division of the trigeminal nerve. This is the ophthalmic division of the trigeminal nerve. It divides into the lacrimal, frontal, and the nasociliary branch. For our importance is the lacrimal nerve, which supplies to the lacrimal gland. Okay, this one is the sensory supply. Now move on to the autonomic supply of the lacrimal gland. Autonomic supply is by the sympathetic and the parasympathetic fibers. First of all, parasympathetic supply is derived from the lacrimal nucleus of the facial nerve. It has two fibers, preganglionic and postganglionic. Preganglionic reach the pterygopalatine ganglion through the nervus intermedius and its greater petrosal branch and through the nerve of the pterygopalatine ganglion. Okay, let's see in the diagram that this structure present here. First of all, there is preganglionic supply. It reaches the this structure is the here pterygopalatine ganglion present in the pterygopalatine fossa. This whole structure is the fossa. So preganglionic fibers are coming from the greater petrosal nerve moving to the ganglion present here. They synapse here. Okay. From here, postganglionic fibers start. We have seen that postganglionic. They leave the ganglion and join the maxillary nerve, then pass into the zygomatic temporal branch, ultimately reach the lacrimal gland within the lacrimal nerve. Again, see in the diagram that from here the postganglionic fibers start, joins the maxillary nerve. Look here, this is the maxillary nerve, pass through the zygomatico-temporal branch and reach here and join the lacrimal nerve and then finally to the lacrimal gland. This was the postganglionic parasympathetic. Now is the we have studied the parasympathetic were divided into preganglionic and the postganglionic. Now is the sympathetic. Postganglionic. This is the only postganglionic. Sympathetic is via the superior cervical sympathetic ganglion. Via the deep petrosal nerve of the pterygoid canal, it goes to the maxillary nerve, zygomatico-temporal nerve, and then through to the lacrimal nerve. Now look in the diagram there. This is the superior cervical sympathetic ganglion located along the internal carotid artery. From here, the fibers come via the deep petrosal nerve. Okay, then goes. Look here. These are going joins the maxillary nerve, then finally the zygomatico-temporal nerve, and they ultimately join the lacrimal nerve and goes into the lacrimal gland. So these are derived from the superior cervical sympathetic ganglion. superior cervical sympathetic. So this was all about the nerve supply of the lacrimal gland. Now, next move on to the topic higher control of lacrimation, which is by the hypothalamus through the facial nerve. Parasympathetic lacrimatory nucleus of the facial nerve receives efferent fibers from what? From the hypothalamus and through the pathway descending autonomic pathway. This is very important, okay? The higher control is through the facial nerve and via the hypothalamus. What is present in the tears? Tears mainly contain lysozyme, immunoglobulin A, and beta lysine. Main function of the tear film is to keep the corneal epithelium moist. And lacrimal canaliculi, there are superior and the inferior lacrimal canaliculi. These are 10 millimeter long. This is very important. Their measurement. Each enter the lateral aspect of the lacrimal sac 2.5 millimeter inferior to its apex. Lacrimal sac is 12 millimeter long. Okay, this measurement is very important. Lacrimal sac and the nasolacrimal duct length is 18 millimeter long. 18 millimeter long. Nasolacrimal duct is narrowest at the middle than at the other ends. Okay, nasolacrimal duct is narrow mostly at the middle of the duct than either of the ends. It opens into the anterior part. Look here, this is an MCQ that it opens into the anterior part of the inferior nasal meatus. They can confuse you by mentioning the posterior part, so remember that it opens into the anterior part. Capacity of the conjunctival sac is 25 to 30 microliters, frequently asked. When volume of the tear exceeds this volume, clinical tearing occurs. Next is the clesion. What is clesion? This is a chronic inflammation of the dorsal gland. Which gland? Dorsal gland, very important. This is localized, progressive, painless lid swelling. This is a painless lid swelling. Important MCQ point. What is hordeolum, also known as the sty? There are two types, external and the internal. External is the acute infection of sebaceous gland of size or ciliary gland of mole, and internal one is the acute infection of dorsal gland of Libomia. Okay, so we'll study clesion and stay in detail in the clinical lecture videos, but at the moment remember this information that clesion is the painless lid swelling of the dorsal glands, while the hordeolum is the sty. It is acute infection of the either the rice gland, ciliary gland of mole, or the Meibomian glands. Now see the MCQs which can be asked from this topic. First of all, sensory supply of the lacrimal gland is derived from which structure? Okay, if you have watched the video, you can easily answer it. And what is the capacity of the conjunctival sac? You can give the answers in the comment section. That was all about today's lecture.